Doctors love their needles, from using them to administer shots that deliver medicine, injecting an anesthetic, to drawing out fluid from joints. When done correctly, there is no lasting harm and minimal damage is done to the body. But practice does make perfect, and doctors are not born with the skills to perform a needle injection flawlessly. There needs to be a way to practice without using live patients. Medical phantoms are an excellent tool that can provide an accurate model of a region of the body that allows for mistakes to be made and then corrected without risk of injury. To further assure accuracy in your well-being, an ultrasound guidance system is utilized. This is a probe placed upon the skin that sends out a beam of high-frequency sound waves. These beams are then reflected back by the barriers between fluids, soft tissues, and bones. An ultrasound guidance system provides a visualization of the position of the needle and the dispersal of the drug being applied. When using with a training phantom, an ultrasound guidance systems help navigate the needle around nerves and through tissues along the path that least harm. The device we designed is a model that provides training for an epidural procedure performed during labor by injection through the lumbar. The purpose of our phantom is to be realistic and affordable while providing quality training.
One of the more basic existing phantoms currently on the market is the Blue Phantom Branch 2-vessel ultrasound training block model, with the cost being $485 and upwards. Despite the Blue Phantom models being able to perform well, they are not accessible for those in low-resource environments. Our team seeked out to find different materials and designs that would allow for a working phantom that performed similarly with the Blue Phantom model at a lower cost. We used the Blue Phantom model as our golden baseline in order to ensure that our design included the features necessary. The qualities that we valued and looked into in creating our design were the ability to mimic the feeling of human tissue, compatibility with ultrasounds, reusability, be non-perishable, affordable and accessible, give training feedback and response, and usability. We used a Pew chart to rank the following models: meat phantom, water phantom, gelatin phantom, PVC polymer phantom with a feedback system, and agar phantom. Since the PVC polymer phantom scored the highest at +12, we decided to use it for our design. The lower cost, accessibility, ability to mimic tissue, great ultrasound image quality, and effective training features of the PVC polymer phantom allow for a high-quality nerve block training phantom compatible with ultrasound systems in low-resource environments.
Our nerve block training phantom has three primary functions. First, to give haptic feedback, second, to give training feedback, and third, to be ultrasound compatible. To accomplish these goals, our device must meet the following functional and performance specifications. For haptic feedback, our model requires functionally to mimic both the feel and anatomy of a real patient. For training feedback, we want our phantom to have the function of alerting the trainee when the needle encounters an unintended target. To elaborate, our model will give an auditory and visual signal when the epidural needle hits an obstacle it is not intended to hit, like an artery or nerve. Finally, because we seek to design a phantom that trains clinicians on ultrasound-guided nerve blocks, it must be ultrasound compatible. To achieve this, we sought materials that had the necessary physical properties to be used for ultrasound imaging. The phantom we designed is composed of two main systems: a multi-layered mold made of modified PVC polymer and a capacitance sensing circuit. The multi-layered mold is the physical bulk of our design. It consists of multiple layers of modified PVC polymer with varying stiffness. Using this multi-layered approach, our model mimics different tissues that an anesthesiologist would typically encounter during an epidural injection procedure.
As you can see in the CAD cross-section of our model, our design includes layers representing ligaments and bones in the lumbar of a spine, including a conductive nerve in the center of the lumbar, a place an anesthesiologist must avoid for an epidural procedure. The frame the synthetic lumbar is in represents the muscles and tissue a needle would need to go through. For the sake of simplicity when presenting our design, peripheral spinal nerves extending from the lumbar are not included.
The purpose of the capacitance sensing circuit is to give training feedback. By measuring the changes in capacitance when an electrically conductive material comes into contact with the sensor, our model can alert trainees with audio and visual feedback if they touch an unintended object like an artery or nerve. This enables trainees to adjust and improve their technique immediately. A prototype of the capacitance sensing circuit is shown here. As you can see, when the sensor is touched by the needle, the circuit returns a loud buzz and the LED is turned on.
In short, our design provides an affordable yet high-quality ultrasound nerve block training phantom that will help clinicians improve their technique and reduce patient complications, especially in low-resource environments.